Progeria is an extremely rare autosomal dominant genetic disorder in which symptoms resembling aspects of aging are manifested at a very early age. Progeria is one of several progeroid syndromes. Those born with progeria typically live to their mid-teens to early 20s. It is a genetic condition that occurs as a new mutation and is rarely inherited, as carriers usually do not live to reproduce children. Although the term progeria applies strictly speaking to all diseases characterized by premature aging symptoms, and is often used as such, it is often applied specifically in reference to Hitchinson-Gilford Progeria Syndrome, HGPS. Progeria was first described in 1886 by Jonathan Hutchinson. It was also described independently in 1897 by Hastings-Gilford. The condition was later named Hitchinson-Gilford Progeria Syndrome. The word progeria comes from the Greek words pro, meaning before, or premature, and geras, meaning old age. Scientists are interested in progeria partly because it might reveal clues about the normal process of aging. Field's disease is considered to be one of the rarest known diseases in the world, with only 2 diagnosed cases. The frequency of this disease is therefore 1 in approximately 3.75 billion, although since the disease manifested in identical twins, the actual frequency is 1 in approximately 7.5 billion. It is named after Welsh twins Catherine and Kirsty Fields, of Llanelli. Field's disease is a neuromuscular disease, causing muscular degeneration. The disease was first noticed when the twins were 4. Doctors have been unable to identify it and have not been able to match it to any known diseases. As a result, the Fields sisters have undergone numerous tests, but no treatment has yet been found. No definitive cause has been determined, and doctors have generally concluded that they were born with it. Also known as Munch-Meyer disease is an extremely rare connective tissue disease. It is a severe, disabling disorder with no cure or treatment and is the only known medical condition where one organ system changes into another. The disorder is caused by a mutation of the body's repair mechanism, which causes fibrous tissue, including muscle, tendon, and ligament, to be ossified spontaneously or when damaged. In many cases, otherwise minor injuries can cause joints to become permanently frozen in place, as new bone forms and replaces the damaged muscle tissue. This new bone formation, known as heterotopic ossification, eventually forms a secondary skeleton and progressively restricts the patient's ability to move. Circumstantial evidence suggests that the disease can cause joint degradation separate from its characteristic bone growth, too. Surgical removal of the extra bone growths has been shown to cause the body to repair the affected area with even more bone. Although the rate of bone growth develops differently depending on the patient, the condition ultimately leaves those affected in a frozen position as new bone replaces musculature and fuses with the skeleton. Some patients have unsuccessfully attempted to position their bodies in a position they would prefer to be locked into during a flare-up. Von Hippel-Lindau disease, VHL, is a rare genetic disorder with multi-system involvement. It is characterized by visceral cysts and benign tumors with potential for subsequent malignant transformation. It is a type of phacomatoses that results from a mutation in the von Hippel-Lindau tumor suppressor gene on chromosome 3p25.3. Microcephaly is not developed properly, resulting in a smaller than normal head. 1. Microcephaly may be present at birth or it may develop in the first few years of life. 1. Often, people with this disorder have an intellectual disability, poor motor function, poor speech. The disorder is caused by a disruption to the genetic processes that form the brain early in pregnancy, though the cause is not identified in most cases. Many genetic syndromes can result in microcephaly, including chromosomal and single gene conditions, though almost always in combination with other symptoms. Mutations that result solely in microcephaly, primary microcephaly, exist but are less common. External toxins to the embryo, such as alcohol during pregnancy or vertically transmitted infections, can also result in microcephaly. Microcephaly serves as an important neurological indication or warning sign, but no uniformity exists in its definition. It is usually defined as a head circumference, HC, more than 2 standard deviations below the mean for age and sex. Some academics advocate defining it as head circumference more than 3 standard deviations below the mean for the age and sex. There is no specific treatment that returns the head size to normal. In general, life expectancy for individuals with microcephaly is reduced and the prognosis for normal brain function is poor. Occasional cases develop normal intelligence and grow normally, apart from persistently small head circumference. Example needed. It is reported that in the United States, microcephaly occurs in 2 to 12 babies per 10,000 births.